Hey everyone, it's Dr. Ben with Silverbush Physical Therapy, where you get one-on-one care. Today I'm going to talk about post-surgical rehab guidelines after a repair of the labrum of your shoulder. The labrum doesn't have any actions by itself, it's simply a support structure. It lines the front and back of your primary shoulder joint. Common ways to injure it include trying to brace yourself from a fall and pressing on your hands, lifting something heavy and you feel pain kind of lining the joint, or just any kind of traumatic injury. Two of the most common repairs we'll talk about today. One is the Bankart lesion, and that one typically occurs when you actually dislocate your shoulder forward. And the other one, the one where you're more like bracing yourself or carrying something heavy, that tends to be a tear that happens going from the front to the back at the connection to the biceps. So here's what you can expect timeline-wise after your procedure. In the first 4 weeks, your surgeon's going to require you to wear a sling, except when you're in physical therapy. Physical therapy will consist of a passive range of motion exercise called the pendulum, several active assisted range of motion exercises where you use what one arm has to help you get more motion in your other arm. And a lot of manual therapy. That manual therapy includes static stretching, joint mobilization, soft tissue work, including myofascial release, and therapeutic massage. So sometime during weeks 4 to 7, typically, but unfortunately not always, sometimes the surgeon, based on the way they did the procedure or the exact nature of your injury, wants the strength training to hold off a little bit longer. But generally speaking, that's when you're going to start your strengthening. Your strengthening is, generally speaking, going to start with stabilizing your shoulder blade muscles first, because that's the foundation of strength for your entire arm. Typically during weeks 9 to 12 is when the surgeon is going to clear you to start strengthening your biceps. Sometimes the doctor does wait a little bit longer, depending on the specific procedure that was done. During this strengthening process, you're starting off with lighter weights, and typically it's not advised that you start really lifting heavy weights until roughly 3 months in. And oftentimes, doctors recommend 6 to 9 months before a return to full sport activities. So those are some general guidelines for your post-surgical labral repair rehab. Of course, your surgeon may have some more specific guidelines for you. If you have any questions or comments, comment below or give me a call at the number below. If you like these videos, remember to like and subscribe. Thanks.